Physiological changes in tobacco use. In the Philippines, 28.3% among adults 15 years or older are current tobacco smokers, representing 17.3 million Filipinos. 13.8 million Filipinos smoke every day, 14.6 million men, and 2.8 million women. 60.6% of current cigarette smokers stated they are interested in quitting. Less than 6 million people die from tobacco use and exposure to tobacco smoke. One death occurs every 6 seconds. There are approximately 600 ingredients in cigarettes. When burned, they create more than 4,000 chemicals. At least 50 of these chemicals are known to cause cancer, and many are poisonous. Smoking is a hard habit to break because tobacco contains nicotine, which is highly addictive. Smoking has numerous immediate and long-term effects on the brain, the respiratory, cardiovascular, immune, and the metabolic systems. Let us talk about the physiological effects or changes in our body associated with smoking. Hematological effects. The nicotine from cigarette smoking induces oxidative stress on erythrocytes. Cigarettes also contain carbon monoxide, a gas released in car exhaust fumes, which competes with oxygen in hemoglobin binding. This causes lower amounts of oxygen to be transported by the blood and carried to the different tissues of the body. As a result, the bone marrow releases more red blood cells to compensate for the decreased amount of oxygen received by the tissues. Higher levels of white blood cells, red blood cells, hemoglobin, and hematocrit are evident in smokers. Cardiovascular. It has been shown that smoking causes the body's vessels to constrict. The net effect is constriction of blood vessels and increasing the endothelin-1, which causes constriction of blood vessels. The net effect is constriction of blood vessels right after smoking and transient reduction in blood supply. Smoking may also lead to thrombosis, which is a process that results in the formation of a clot inside a blood vessel. This process may result in blockage of blood vessels, stopping blood flow to vital organs. In addition, thrombosis especially occurs around sites of plaque formation. Such narrowing can impair blood flow to the heart, brain, and other organs, causing them to fail. Nicotine increases a resting heart rate, wherein there is also an increase in blood pressure as soon as 30 minutes after puffing. The higher nicotine consumption, the greater the heart rate. This gives the heart a higher workload.